Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Emotional blunting. What to know about feeling less feelings. Emotional blunting occurs when you have a decreased response to all emotions. It's different from a disinterest in things you once enjoyed, anhedonia, which is often associated with depression. Emotional blunting is not an official medical condition or diagnosis and doesn't have a universal definition. Instead, it's seen as a symptom of either a mental health condition or a side effect of medication, like antidepressants. /r/n/r/n illustration by Tara Anand for Verywell Health/r/n/r/n People often describe emotional blunting as feeling numb. Their emotions feel muted, and they don't experience the highs of happiness and joy or the lows of grief and sadness. This feeling of numbness can mean not being able to cry when you experience something sad, smile during joyful moments, or feel empathy for others. /r/n/r/n Other ways to describe how emotional blunting feels are, /r/n/r/n Emotional blunting is a common antidepressant side effect. According to one study, 46% of people on antidepressants experienced emotional blunting. In another, over one-third of people discontinued antidepressants due to emotional blunting, as well as symptoms like lethargy, anxiety, and shaking. /r/n/r/n While it's pretty widely accepted that emotional blunting is an antidepressant side effect, some researchers suggest that it could also be a persistent symptom of depression. /r/n/r/n Scientists are still trying to understand why and how antidepressants cause emotional blunting. It seems related to serotonin's effects in the brain's frontal lobe, where emotions are processed. /r/n/r/n One 2023 study found this may be due to antidepressants' impact on reinforcement learning sensitivity. The groundbreaking research recruited healthy individuals not experiencing depression and sorted them into two groups: a group that took the antidepressant escitalopramthe generic form of Lexaprofor for at least 21 days, and a placebo group, one given an ineffective substance to act as a control group. /r/n/r/n By using healthy individuals, the study aimed to clarify what side effects were due to the antidepressant itself rather than symptoms of depression. /r/n/r/n The two groups were similar on all cognitive measures, except that the antidepressant-using group was significantly worse at reinforcement learning. This means that, unlike the control group, they did not change their behavior based on positive or negative feedback. /r/n/r/n The researchers suggested that this could explain why some people experience emotional blunting while on antidepressants. Their theory was that antidepressants work by reducing a person's negative emotions, but they also reduce the person's positive emotions at the same time. /r/n/r/n Emotional blunting is a reduction of all emotions across the board. /r/n/r/n It is not the following, /r/n/r/n These are also common symptoms of depression but encompass different experiences than emotional blunting. /r/n/r/n In addition to being a possible side effect of antidepressant use, certain mental health conditions can also cause emotional blunting. /r/n/r/n These include /r/n/r/n In most cases, emotional blunting is temporary. Its duration depends on the underlying cause and whether it's treated. /r/n/r/n If you're experiencing emotional blunting as a side effect of a mental health condition, like PTSD, schizophrenia, or substance use disorder, treating that condition with therapy or medication could help reduce your emotional blunting. /r/n/r/n On the other hand, if your emotional blunting is a side effect of antidepressants, discuss your options with your healthcare provider. They will likely recommend altering your prescription. /r/n/r/n It's very important to talk to a healthcare professional before changing your dosage or stopping an antidepressant. Some antidepressants can have severe side effects if they are stopped cold turkey, and require a plan to titrate, slowly lessen, in order to prevent these ./r/n/r/n emotional blunting can significantly impact your well-being, social health, and relationships with your family and friends. /r/n/r/n If you have emotional blunting, you may notice that you aren't as happy or energetic in your daily life. People may be frustrated with you, or you may see yourself withdrawing from family and friends. It can feel like you're living life on autopilot. /r/n/r/n If you're on the other side and think that someone you care about has emotional blunting, it may seem like that person is trying to detach from your relationship. It can also be hurtful if they aren't empathetic to your emotions. For example, you share exciting news with them or perhaps a sad loss, and they don't respond appropriately. /r/n/r/n It's not easy, whichever side you're on, so discussing your options with a healthcare provider or encouraging your loved one to seek professional help is essential. /r/n/r/n Coming out of emotional blunting is possible, but treating your underlying cause is required. /r/n/r/n In the case of emotional blunting as a side effect of antidepressant use, your healthcare provider will opt for one of 3 treatment methods, listed from most to least common. /r/n/r/n When emotional blunting is the result of a mental health condition, it's best to have a proper diagnosis and treatment plan to cope. Your plan will likely include some form of psychotherapy or talk therapy. A mental health professional can help you find coping tools to reduce this symptom. /r/n/r/n Being unable to experience the full spectrum of your emotions can profoundly impact your life, whether by damaging relationships or giving you a sense of not experiencing life to its fullest. /r/n/r/n Talking to other people who are going through something similar can help. Consider joining a support group online or in person for people with your specific mental health condition. /r/n/r/n Alternatively, you may benefit from talking to a licensed psychotherapist. /r/n/r/n Emotional blunting is a state of emotional numbing when you experience diminished emotions. In some cases, it may be a symptom of a mental health condition like depression or schizophrenia, or it may be a learned coping mechanism for trauma. In other cases, it can be a side effect of antidepressant medication. Generally, lowering the dosage or changing the medication can help. Talk to your healthcare provider if you are experiencing emotional blunting. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.